Getting back to shape is one of the most important issues for a woman, especially after pregnancy. However, the move and the bounce back to their previous body shape is not as fast as they desire. One of these reasons is a condition known as Diastasis Recti. We have an expert today on Wanja's Health Diary who's going to take us through what is Diastasis Recti. Welcome, Dr. Muthoni Gichu.
Thank you.
What is Diastasis Recti? Sounds like a long Italian word.
Unfortunately, it is as simple as the separation of the abdomen. And not the abdomen, but the muscles of the abdomen.
What causes the separation?
Many things could be, but when you look at pregnancy, is one thing that causes the separation. But behind that, there is the weakness that comes with time on muscles that have not been used. So what happens is, with muscles, you either use them and it looks good, or you lose it because of not using it, or create weakness. So whenever a weakness is created, it means that these muscles are not at their optimal. So what does that mean? Anything else that comes placing pressure on the same muscles can only stretch and expose the weakness.
Why is it more common amongst women as compared to their male counterparts?
It is more because women get pregnant. So there's an opportunity to actually stir the waters, if I could put it that way. So it will be evident among the women before it is evident among the men.
How does it look like?
This is what it looks like. It looks like, basically what I would put it is, there's a very thin sheet, normally when there are muscles, you will feel the muscle. But on this one, it feels like a thin sheet. It actually feels like a sheet on the abdomen, at the middle part of the abdomen. It is not just anywhere. It is at the middle of the abdomen. So it feels a thin sheet, but it is not muscular. It's more of cartilage or, something close to that, but it's more soft.
How do you measure it? And is it anybody who can, check on it probably at home and say, I think I have Diastasis Recti?
Several methods can be used. You can use fingers, you can use a tape measure, you can use an ultrasound. Again, it's not everybody who can do this. So, and that is why it is important to consult with your doctor when you notice this kind of thing. Yes.
There's an urge to, want to go back to the gym, and especially after pregnancy. And there's this rule that, it's ideally after 6 weeks. What is the effect of the gym in, treatment or the management of Diastasis Recti?
Again, if you are under maybe an exercise physiologist or a physical therapist who actually understands the condition and is working to strengthen the abdominal muscles. But now remember, for the abdominal muscles, we have the ones that are outside and the ones that are inside. So we can strengthen the inside ones, the ones that are inner, to be able to deal with that weakness. But again, going to perform the usual things we do in the gym, we're likely to increase the risk of worsening it as opposed to rehabilitating it. And this happens especially when somebody will not say, or maybe has not even realized. So we might end up with a hernia.
Okay, and what is a hernia?
A hernia is basically now an opening when now the sheet gives way. So it's like a window. And you will notice that intestines can sometimes go through this window. And when the intestines go through this window, it will simply turn into a medical emergency. So we need to be watchful on that.
Is there a time that you would say it is too late to act on a possible Diastasis Recti?
It's never late because there are options of rectifying it. You can do the physical therapy and you can also do surgery. Yes.
But in terms of surgery for a condition that you would manage it otherwise, what would you advise?
It depends on the extent and how far it has gone. Because again, if you have a separation that has gone into a hernia, it means you need to urgently address the hernia. Because the separation here will not be the issue. The hernia is what will cause an emergency, which needs to be dealt with as soon as possible.
Okay. And for a person who has Diastasis Recti and is trying to rectify that through the gym, what are some of the exercises that they can do and what can't they do?
It's not one size fits all.
Yeah.
Because again, we need to assess this particular individual. What is the extent? What it is that we can do. It's just the same, you have drugs. It's not a drug that fits everybody. Yes. But it is necessary to avoid any exercise at that point that puts pressure on the abdomen. Even sit-ups themselves sometimes could actually cause more harm than good. The planks, you know? Yeah.
All right.
So we need to focus on strengthening the core.
All right. What is an ideal time that you would say, with the right kind of expertise that it takes to the management of diastasis recti?
Whether you can live with this for all your life, as long as it is not causing problems, because sometimes you can get into complications of chronic back pain, constipation, and you see, when it gets to that point, it means we need to address. But as long as we can manage with exercise, or if it goes to the extent of doing surgery, then we need to do it.
And what are the chances that a woman will have this condition? And is it a failure of, certain muscles failing to close after pregnancy?
I would say it is more of exposure prior to pregnancy.
Okay.
So how do you prevent this? Begin from an early age to work on your abdominal muscle. If you plan to get pregnant, begin early enough to make sure your abdomen is strong enough.
All right, thank you so much. We really appreciate. And there you have it. Going back to the gym after pregnancy isn't as easy as 1, 2, 3. Get medical advice, and this will sort out some of the conditions, including diastasis recti.